Exploring electroencephalogram EEG testing, importance in medical diagnosis and neurological assessment. Introduction. Electroencephalogram EEG testing is a non-invasive diagnostic procedure used to record and analyze the electrical activity of the brain. This test plays a crucial role in medical practice, providing valuable insights into brain function, diagnosing neurological disorders, monitoring brain activity during various conditions, and guiding treatment decisions. In this comprehensive guide, we'll delve into the significance of EEG testing in medical practice, its procedure, interpretation, and the conditions it helps diagnose and manage. Understanding electroencephalogram EEG testing. An EEG is a diagnostic test that measures the electrical impulses generated by neurons, brain cells, in the cerebral cortex. These electrical signals, known as brain waves, are recorded using electrodes placed on the scalp. EEG testing captures the spontaneous electrical activity of the brain and can detect abnormalities in brain wave patterns associated with various neurological conditions. Procedure of EEG testing. The EEG testing procedure typically involves the following steps. Preparation. The patient is instructed to wash their hair before the test to remove any oils or residues that may interfere with electrode placement. Certain medications, such as sedatives or stimulants, may need to be temporarily discontinued before the test to obtain accurate results. Electrode placement. Small metal electrodes are attached to the scalp using adhesive or a special gel. The electrodes are strategically placed at specific locations on the scalp according to the International 10-to-20 system, which allows for standardized electrode placement and optimal recording of brain activity. Recording. The electrodes are connected to an EEG machine, which amplifies and records the electrical signals generated by the brain. During the recording session, the patient may be asked to perform certain tasks, such as closing their eyes, breathing deeply, or looking at a flashing light, to elicit specific brain wave patterns. Interpretation. Once the recording is complete, a trained neurologist or EEG technician analyzes the EEG data to identify any abnormalities in brain wave patterns. The results are interpreted in conjunction with the patient's clinical history and symptoms to make a diagnosis or guide further evaluation. Importance of EEG testing in medical practice. EEG testing is indispensable in medical practice for several reasons. Diagnosis of epilepsy. EEG testing is the gold standard for diagnosing epilepsy and seizure disorders. Abnormal patterns of electrical activity captured on EEG, such as epileptiform discharges or spikes, can confirm the presence of epilepsy and help localize the seizure focus within the brain. Evaluation of altered mental status. EEG testing is valuable in assessing patients with altered mental status, confusion, or coma of unknown etiology. It can detect abnormal brain wave patterns indicative of underlying neurological conditions, such as encephalopathy, metabolic disturbances, or structural brain lesions. Diagnosis of sleep disorders. EEG testing is used to diagnose various sleep disorders, such as sleep apnea, narcolepsy, and parasomnias. Sleep EEG recordings, known as polysomnography, assess brain wave activity, muscle tone, eye movements, and respiratory parameters during sleep to identify abnormalities and guide treatment. Localization of brain lesions. EEG testing can help localize the site of brain lesions, such as tumors, strokes, or infections, by detecting changes in electrical activity corresponding to the affected brain regions. This information is valuable for surgical planning and guiding interventions aimed at removing or treating the lesion. Monitoring brain function. EEG monitoring is used in critical care settings to assess brain function and detect abnormalities, such as seizures or ischemia, in patients with traumatic brain injury, stroke, or cardiac arrest. Continuous EEG monitoring provides real-time feedback on brain activity and helps guide treatment decisions in these high-risk patients. Assessment of cognitive function. EEG testing is increasingly used in research and clinical settings to assess cognitive function, attention, and memory processes. Quantitative EEG analysis can detect subtle changes in brain wave patterns associated with cognitive decline, dementia, or psychiatric disorders. Conclusion. Electroencephalogram EEG testing is a valuable diagnostic tool in medical practice for evaluating brain function, diagnosing neurological disorders, and guiding treatment decisions. By recording and analyzing the electrical activity of the brain, EEG testing provides valuable insights into brain health and helps clinicians make accurate diagnoses and formulate appropriate management plans. As such, EEG testing plays a crucial role in promoting neurological health, improving patient outcomes, and enhancing our understanding of brain function and dysfunction.